Hello everyone, I am Dr. Rahul Dubbaka, consultant gastroenterologist and hepatologist, Care Hospital, Banjara Hills. Today we will be talking about chest pain which is non-cardiac related. Many a time patient presents with chest pain, but the ECG, the 2D echo or sometimes the coronary angiogram, all these things will be normal, but the patient will be complaining of recurrent chest pains. So these are called as atypical chest pains or non-cardiac chest pains. So the primary cause for a non-cardiac chest pain or an atypical chest pain is acid reflux, that is gastric esophageal reflux disease. So when there is an excess amount of acid secretion in the body, that is the stomach, there will be reflux of the acid into the esophagus. So because the esophagus is located in the thorax, that is the chest cavity, sometimes the pain may mimic a cardiac chest pain. So sometimes the patient may be apprehensive that this pain might be a cardiac chest pain, and immediately he will consult a cardiologist. So if you ask what are the significant differences and how to differentiate between a cardiac chest pain versus a gastric esophageal reflux disease chest pain, so the points to be remembered is the patient with cardiac chest pain, apart from the chest pain, the pain may also be radiating to the left side of the arm or sometimes to the right side of the arm or to the jaw also. And also the patient will also present with either excess sweatiness or excess palpitation, that is increase in the heartbeat, or sometimes also with shortness of breath. These are the common symptoms which can be associated with a cardiac type of chest pain. Whereas a non-cardiac type of chest pain or this gastric esophageal reflux disease chest pain, these symptoms may not be present with the patient. And sometimes the patient may also experience the pain after eating a heavy meal, or before the chest pain starts, the patient may also have some abdominal discomfort, or there may be excess belchings, or sometimes belching may also relieve the chest pain for some time. Or the other important thing which can be done is immediately if the patient, especially if he is above 45 years, the first thing we have to do is we have to definitely rule out a cardiac chest pain. So the simply taking an ECG or a basic 2D echo will also help us in differentiating between the cardiac chest pain versus the non-cardiac chest pain, because sometimes both may mimic each other and may be almost similar symptomatically. And also if the patient ECG and 2D echo are normal, we have sometimes give a tablet or an injection to suppress the acid content, and if the patient responds to these medications within 20 minutes or 30 minutes, then it is also an indirect indication that the patient may be, the pain may be because of a non-cardiac chest pain or the gastric esophageal reflux disease chest pain. Apart from this, sometimes muscle pain or costochondritis, that is inflammation of the joint and cartilage area, that is the cartilage area which is called as costochondritis. This may also mimic a chest pain, but these kind of chest pains, they worsen with movements, and also taking adequate rest may relieve the chest pain. So simple anti-inflammatory medications, the patient will have a very good relief from the chest pain. Thank you.